So I'm Conor Crowley. I'm an adult mental health social worker here in Blackpool Primary Care Centre. I'm here for the last 8 years. I work part of a multidisciplinary team in the City South East sector in Cork. So for World Mental Health Day, we've I suppose here as part of the multidisciplinary team, myself and the rest of the team have tried to organise different events in the last couple of years. And this year we organised an information kind of seminar event at the entrance of the Primary Care Centre, kind of trying to promote mental health and well-being for the general public, but also for members and professionals within the Primary Care Centre. I suppose we set it up on a day that there was a clinic here, adult mental health clinic, and again to try and promote people to kind of pick up information, to see what else is out there. It was overwhelmingly positive, the feedback that we got from anybody who did attend, and I suppose it was again with the support of my multidisciplinary team that we all manned the stands, and plus there was the service users present, so kind of peer support for people as well were there. Because of that, it didn't matter what age group came along. There was a lot of freebies that people could take away, from trolley tokens to pencils to rulers to stress balls, but again, so that we're trying in a way that we were trying to welcome people in a way that was non-threatening, that people could just pick things up and head off to their appointment and maybe touch base on the way back. It's a testament really to the team, you know, not even so much myself, you know, because it would be impossible to do any of these interventions with people and events with the general public without having a great team.
What I have noticed is that the amazing relationship, not only as team members we have between ourselves, but with everybody we encounter, the multidisciplinary team. Well, I suppose we had a student public health nurse last year, and under her recommendation, after she did the area profile of Kinsale, she felt there was a gap and maybe setting up a baby well group. So we did start that last year on the 4th of November. And in that time, we've had over 200 mothers and babies attend every week. And this is a drop-in clinic. This is not by appointment, and where they're encouraged and supported, especially around breastfeeding and around the bonding of the baby with the parent, with the partner, although it's mainly mothers. And it's completely run by the public health nurses. It's every Thursday, and there has never been a Thursday that someone hasn't turned up at these groups. And also we have educational sessions there. We had Lucy Wolfe, the sleep consultant, do a presentation, and our next presentation will be by the paediatric community occupational therapist. We're very involved in the care needs from anybody from birth right through to death, and we support each other around that. The care needs for the patient is paramount. I mean, the patient is paramount. So our ethos is, what can we do now at this present moment in time for this person, whatever care needs are required to maintain them living at home for as long as possible and supporting the family in doing this. The public health nurse is the link, and the community nurse is the link. And I've noticed that there's great communication, continuity, cooperation, and above all, caring. I'm privileged to be in their company. I'm privileged to be associated with them, and I'm privileged to be working alongside them, and they just are amazing. And I feel they deserve this nomination, and it's wonderful that they are nominated, and it's wonderful that it's being, you know, that they're being listened to, and the work speaks for itself, and the feedback that we get from the people, the beautiful people we look after, just speaks volumes, and it's around the care that is given from the team in Kinsale. And especially there are people, you know, that I know would be in hospital life for the care they received from the staff in Kinsale, and how wonderful. It's amazing.
The Health and Wellbeing Committee is very much run by staff for staff, so it has provided an opportunity to engage. So I think the biggest thing for me is a lot of us work in our own silos, and I suppose we don't get an opportunity to meet some of the staff within the wider disability services, and also those that share the building with us. So the team have provided an opportunity for meet and greet coffee mornings, where we've been able to engage with staff we wouldn't ordinarily engage with through the course of our work. I suppose very much the initiatives are those that are wanted or requested by staff. So I suppose it's increased the morale among staff, and I suppose health and wellbeing isn't something that we do separately. It's almost part of, I suppose, being an employee here in Blackpool, and it's very much ingrained in the daily life here in Blackpool.
So these are my duty every week. I update them on a weekly basis. I put in details such as what we're going to do this week, walking, having group activities like mindfulness. We put up the newsletter just to get everyone in the office involved, and it's always there so they can never miss it.
One major part of our committee is the introduction of fruit, which I do think, we all say about eating five pieces of fruit a day. It's definitely very much happening here. We buy the fruit out of kitty money every week. We're after getting very healthy, we'll say, with little resources here.
So we decided as people in the office that we needed to drink more water. So our initiative is very simple. It was a bell that we ring, and it's just a reminder for everyone to get up, walk to the cooler, pour some water and have a drink. People are hydrated, and they're also getting to move and stretch. Generally, people have really felt that it's something very catchy, and that the bell rings and it kind of changes the mood in the office. So people are also getting the water that they need, but it's also just kind of breaks the climate of the work that maybe they were focused on, and then they can refocus again. So it's been very positive. We were very surprised and excited when it came through. So it's great that we get to celebrate together.